I'm Debbie Atkins, and I am the Director of Crisis Coordination for the Department of Behavioral Health and Developmental Disabilities in Georgia. And somehow I got wrangled into being a guest host today, so hopefully things will run smoothly. Brian, you're a tough act to follow for the past few weeks. You know, you've got all your experience. These are our national organizations in the states that are on the call. You'll see the Medicaid is in blue if you are in attendance. So if you don't see yourself listed, please email David and Karen, and they will make sure the map gets updated. We do like to track and see who all's on the call. As you can see, this is a very large group for participation. So it's very exciting to have this many people talking about crisis. And this is the crisis talk page. So this is everything you need to know. This gives you the Zoom link to join us every week. It also will have all the information on the learning community. So you can look at past talks. This is videoed every week and you can download it, look at everything, the handouts, all that's in the talkcrisisnow.com and under the learning community. So make sure you bookmark that and have access to it on your computer. And this shows the different talks. So you'll see that there is our past trivia, our crisis matrix, and a lot of the featured talks that we've had. So very useful website, a lot of information there. So if you ever really want to just dig in and get caught up over the past year's worth of information, this is where you go. So today, as part of our crisis talk, Stephanie is not with us today. She had a previous engagement, but Dr. Matthew Edwards is going to be here to talk a little bit about the interview he had with Stephanie. Dr. Edwards, are you on?
I am.
Great. Would you like to highlight a little bit of the Supporting Resident-Centered Crisis Responder article that you and Stephanie did?
Sure. The interview and the article that followed was based on one of the Nashville papers that Dr. Peinels and I authored on crisis services for diverse populations in 2020. And it also sort of linked that work with a more recent Nashville paper on past partnerships and lessons for crisis services in the future of 988. And in it, we talked about how we moved to 988 and we envision building a system that's responsive to needs of diverse communities. What types of infrastructure, considerations, implications for diversity, and workforce priorities and opportunities we should consider as we roll that out. And I think Stephanie highlighted a lot of really important points about kind of thinking about sort of the opportunities that this presents, how we bring in people who might, have a particular concordance or shared demographic or shared experience with the community, and how that presents many opportunities, and how that might also present some things that we will have to sort of consider ahead of time, so that we don't, run the risk of further traumatizing vicariously or in other ways those communities that serve. And I think we also talked quite a bit about ensuring that members of this sort of diverse population and group also have some opportunities to really kind of have a seat at the table in becoming partners and allying with policymakers and stakeholders in a way that's both robust and meaningful, that they have real influence in deciding what works and what doesn't work, and how to contribute to the systems as they're developing. And we looked at this through the lens of some of my work in history, looking at programs like Freedom House and other models that have shown that African Americans in particular have had a history of linking with community partners, allies, universities, and such, and how often as we move to standardize these types of programs, those things that really make them really unique and robust community and local driven solutions can sometimes get outsized. And so
Sounds like y'all covered a lot in a short amount of
talked about a
time.
lot. Yeah. And so I think I'll leave it there. And, I think the rest of the article sort of talks about those themes.
That's wonderful. So for any of you who didn't get a chance to read it, go over to the Crisis Talk page, pull down the articles, and if you don't subscribe, please do. Stephanie is a very gifted interviewer, and if you get asked to be a part of one of her stories, say yes, because she makes the process very easy, and she really does bring out some great items in her articles. So you can get Dr. Edwards' article and then all of the previous ones as well. So pull it up on the Crisis Talk website. So next, we have our quote of the week. So this came from the Pew Charitable Trust from Yolanda and Tiffany, and this is work that they're doing with Stepping Up Fulton County. And I've had the blessing of working with them a good bit in the partnership with our Fulton County partners. So we're told you're not going to be able to change it. We were told this has been tried before, and we ignored them. A great quote for us as we look to make changes in the crisis system and in our states. So just keep plugging along, use your creative ideas, and we're going to get there. So next we have with us Ben Miller and Lisa Daly. They did a report, which is a comprehensive roadmap for imagining crisis response and mental health. Ben, Lisa, are y'all on? We're going to give y'all a few minutes to talk about your report.
Excellent. Thank you so much. I want to make sure Lisa's on here because this is one-man show is not too fun for anybody. Lisa, are you on as well?
Yes, I'm on.
Awesome. Well, first of all, thank you for having us on today. My name is Dr. Ben Miller. I'm the president of Wellbeing Trust. We're a national foundation focused on advancing the mental, social, and spiritual health of the nation. And we're here today to talk about this new document that was alluded to on crisis, but I want to provide a little context before Lisa goes into the document itself. Early on in 2020, at the beginning of the pandemic, when I think probably all of us thought it was still cool to have a new hobby, learning how to paint, read more, et cetera, chief executives of 14 national organizations focused on mental health and professional associations came together to create a unified coalition with the goal of engaging the federal government, state leaders, other elected officials on ways that we could better address issues of mental health and addiction in our country. The leadership was initially composed of CEOs from the American Psychiatric Association, American Psychological Association, Massachusetts Association of Mental Health, Meadows Mental Health Policy Institute, Mental Health America, National Association for Behavioral Health Care, National Alliance of Mental Illness, National Council for Behavioral Health, One Mind, PEGS Foundation, Steinberg Institute, Kennedy Forum, Treatment Advocacy Center, and Wellbeing Trust. That is a lot to remember. The group created a unified vision document because it was recognized that it's going to be so difficult to partner collectively if we didn't have a collective vision. And so that document we can share. One of the pillars of that document, of the 7 pillars, is around crisis. The leadership group decided that it would be really important for us to, again, come together and have consensus around what goes into a crisis continuum, which is the document that we released about 2 weeks ago that Lisa is now going to talk about. Lisa, I'll turn it over to you.
Thanks, Ben. And everyone, I'm Lisa Daly. I'm Executive Director for Treatment Advocacy Center. I'm just going to say a few words about what the intent and the purpose of this consensus document are. As crisis response has increasingly been at the forefront of our discussions at the national level, and as July is coming closer and closer, which is the implementation of 988's official launch, our alliance of organizations saw that this was really an opportunity for 988 to be a transformative moment for our mental health system generally. So as we know, 988, like most kinds of programs and most other things, is going to be implemented by each state on an individual basis. So the goal of the document that we created is to provide an overarching vision for the launch of 988 that is shared by our broad coalition of advocates and experts and leaders in the mental health, kind of industry and advocacy community. We just kind of figured that by speaking with one voice on the subject, our goal will be to communicate to lawmakers at all levels and to the media and implementers and to the public generally, that while the field encompasses a lot of differing opinions on almost every subject, there's broad agreement on how we need to go about building a continuum of care that can actually succeed. So the consensus document that we drafted is it's intended to support the efforts of people like yourselves who are down in the weeds and who are kind of really doing the heavy lifting work of drafting legislation and shaping plans for a new crisis response kind of reimagining. So all of us who are here today are paying a lot of close attention to 988 and what that's going to look like in July. But a recent study by NAMI that we certainly were aware of has indicated that a majority of people are not really aware of it and don't really know exactly what it is or what it's for. So this document, which I've shared in the chat for everyone as a link, the intent of it is to give everyone a tool that we can give and share with advocates and the media and lawmakers, or really anyone who wants to have a better grasp of what 988 is intended to do beyond creating just a number and what steps are available to move in the direction that we all sort of have a consensus that we want to go in. So we encourage you to widely share the document as much as possible as you continue with your important work. It's available on basically all of the websites of the organizations that were co-authors of the document, but it's also available in the chat as a link. It's downloadable as a PDF. So we just encourage you to share it broadly and to use it as a tool to kind of help engage the public, lawmakers, media, everyone in kind of understanding what the overarching goal is for 988 as an industry, as just kind of getting out of the weeds a little bit and to provide a tool to all of you as implementers for that purpose.
Thank you so much. And like she said, the link is in the chat. Pull it up, share it. As a state 988 implementation lead, it's very important that we really start looking at this, looking across these 7 pillars, and can really come to some consensus of what our responsibility is as states as we move to implement. So thank you both for this incredible work. Any questions for them? I see some coming up in the chat, a lot of thank yous and sharing. I think one thing, the way our slides are set up, can you read through the 2nd and 3rd pillars so that people can see what those are? There's a block on the screen.
I can just read all 7 pillars if that's easy.
That would be great.
Early identification and prevention is pillar 1. Pillar 2, emergency and crisis response. Pillar 3 is equity and inclusion. Pillar 4 is integration and partnership. Pillar 5 is fair and equivalent coverage. Pillar 6 is standards of care. And pillar 7 is workforce capacity.
Great. Thank you. And I think that was all the questions. So great. Thank y'all very much. So now we're going to transition into our featured speakers for today, the Alabama Crisis System of Care. And today we have Commissioner Kim Boswell with the Alabama Department of Mental Health. And Kim, I'm going to turn it over to you to tell us what you're doing in Alabama.
Great. Thanks, Debbie. And let me just give first a big shout out to Georgia. Judy Fitzgerald and her team have been very generous over the last 3 years with their time and resources. And we've made many, many trips to Georgia to see what Georgia is doing. So just wanted to take this opportunity to thank them for being so gracious with their time and resources. And we're very excited in Alabama about our crisis care initiative. We were very fortunate in the spring of 2020 that the national guidelines for behavioral health crisis care was published right as we were developing our RFP for crisis services in Alabama. So as you see on the screen, the essential principles and practices were included in our RFP process. So We really have reinforced with all components of our crisis system of care that those principles and practices are the standards, part of the standards that we want to meet with crisis services in Alabama. We were able to stand up our first 3 crisis diversion centers. Now we just call them crisis centers in Alabama in May of 2021. They started delivering services in May. And so we're very excited about that. And this map just gives you a little bit of an idea of the reach of those crisis centers, as well as our 4th crisis center, which is Jefferson Blunt St. Clair, which is sort of in the middle of the state. So the good news is we now have a crisis center in all 4 of our mental health regions. And so we're very excited about that. The little squiggly lines are the counties that those crisis centers have relationships with, either with a liaison or sometimes sort of admissions coordination and those kinds of activities. Next slide, please. We are requesting in the 2023 budget for 2 additional crisis centers. Those are in green. We are hoping to receive that funding. We'll probably know by the end of March whether or not we're going to be able to add those 2 centers to our list of crisis centers across the state. In Alabama, through our 988 initiative, really, we've projected that we need somewhere between 10 and 11 crisis centers in Alabama. So if we're able to add those 2 this year, it'll bring us up to a total of 6. Next slide, please. In addition to our crisis centers, we were very fortunate in Alabama that members of our legislature wanted to try and address rural communities in our state. As you know, Alabama is a pretty rural state. And so originally there were 5 rural crisis projects funded in Alabama. Those are the projects you see in gold. In essence, we created mobile crisis teams in those communities because obviously in a rural community, transportation is one of the biggest barriers to getting services. And so we really used the mobile crisis model as our rural model in Alabama. We were able also, with the increase in the block grant this year for crisis service set aside, we are adding an additional mobile crisis team, Spectra Care, which is down in the corner of the state, as well as an additional team using the ARPA funding for crisis set aside. So that'll bring us up to 7 that we consider to be following the national guidelines for rural crisis model. All right, next slide, please. We are very fortunate to be one of the states that received the CMS state planning grant for qualifying community-based mobile crisis intervention services. We do have those 7 teams that we talked about, but historically we've had 5 other teams that were doing their best to sort of piece together funding in order to provide services. And a big part of what we want to do with the grant is bring those other 5 teams up to the standards, really using the national guidelines. And so that's really important, as well as hopefully finding a way to use Medicaid authority to fund mobile crisis services moving forward. And with that almost $1 million investment from the grant, we really hope that we'll be able to work with our Medicaid agency and be able to find a good, steady funding stream for mobile crisis services in Alabama. This is really the first time, well, second time we've engaged our Medicaid agency in the work. We're really excited about this project. They also have been at the table with our 988 study commission. And so we're really excited about having them at the table and working alongside us to expand crisis services in Alabama. Next slide, please. And this is sort of a summary of our funding for crisis services in Alabama, the state funds that are being used, and a little bit of a description of how we're using ARPA funding to bridge funding to where we want to be in 2024 and 2025. And so I saw another one though on the crisis jam. Looked at it yesterday that I like better. So I'm going to be revising this slide because I like the one that was on the crisis jam. It was really, really good, that broke it down by the three components of crisis care. So Alabama is really moving to CCBHC, and a big part of what we're using our ARPA funding for is to make that transition. As it is with many states, workforce is a huge issue for us. We need funding for our 988 initiative as well. Our legislative committee decided not to do a surcharge or any kind of fee this year. It's an election year. So we'll be picking that back up next year. And so we're hoping to use some of the ARPA funding to bridge all of that. Next slide, please. So this is my favorite quote from Crisis Jam because I'm a systems person and I'm also a singer. And so this is my favorite quote. There's a lot of talk about different crisis services and programs, but all the pieces must work together as a system. That is really why we're so excited about 988, because we really see 988 as the thread that pulls the whole system of crisis care together. Next slide, please. And just always want to bring us back to why we do what we do. This beautiful charcoal drawing of Emmett Till was done by a gentleman who resides in our forensic hospital, Taylor Hardin Secure Medical. He's doing really well. The gentleman has an IQ out the roof. In addition to being a great artist, he's also a great musician. Had we had 988 in place when he experienced his first episode of psychosis, he would have hopefully gotten into crisis services instead of spending 3 years in Taylor Hardin Secure Medical. He's doing really well. We eventually hope that he's going to be a peer specialist for us, but just kind of wanted to bring us back to why this crisis work is so important. And that's it, Debbie. Thank you.
Thank you. Y'all have been very busy, and a shout out to Margie Balfour. Dr. Balfour's quote is the one you quoted. Are there any questions? I think the one that I saw in the chat was really about the funding streams, and you answered that. Anything else for Commissioner Boswell before we go to the roundtable? Okay, I don't see any new ones. Great job. We're so thrilled to see what y'all are doing, and I look forward to seeing more to come. So now we're going to move to the roundtable discussion, and this is two of the providers in Alabama. So Jeremy Blair is the CEO of Wellstone, and Turk, I'm going to mess up your last name, Schlesinger, with AltaPoint. I've had the privilege of working with both of them and their teams. They are brilliant men and great visionaries. So I'm going to turn it over to the two of you to kind of give us some feedback and discussion about how things have been on the ground.
Thank you, Debbie. I think for us, it's, as the commissioner said, it's been a really busy spring and summer for us as we really have come to the table many times on 988, in addition to launching our crisis diversion centers back in May. So it's been a pretty whirlwind of activity, but it's been really good. Now that we're 6 months into our temporary operations, we're starting to generate some really good data on the effect of the diversion centers and what that is meaning to our system as a whole. And so we are definitely encouraged by that data. It really kind of affirms that we're going in the right direction with our system, and look forward to continuing to roll out additional crisis centers. I know the one in Birmingham will come online in 6 to 8 months. And our other partners will continue to spin up their components, whether it's mobile crisis or diversion. And so I think it's encouraging to see the direction that we're taking things in the state.
I can jump in too. Can everybody hear me okay? I'm actually at a hotel in Tallahassee.
Yes.
Good, good. Well, we're also, like Jeremy, very excited to be on this journey. We've actually been in operation since May. I think really the important thing that we're doing right now is analyzing and rolling out a systematic approach to bringing all the stakeholders in the 7 counties that we have into place. I think when you start thinking about how many stakeholders are in place and what in order to access the system, it becomes a little bit daunting. When you think about the sheriff's office in 7 counties, the municipalities in all 7 counties, we have 17 hospitals and freestanding emergency departments in those counties. And so that part of it has been an important part, but it's also a part that's not taking place immediately. I think there's training that has to go on with each of those entities. We're doing that through Southwest Alabama Hospital Association. We're doing it through training, CIT training, and those sorts of things with the different law enforcement officers. We're also working with the jail. I think the Stepping Up program was right in step with what we needed during this time. And I think it's just been an incredible experience. One of the things that we talked about the other day was that whenever we started doing an analysis of the patients that we're already seeing in our crisis center, it really it goes back to me on why we started our access to care call center. And what we're seeing in our crisis center is we're seeing people that are not necessarily our patients or consumers who have been in our system all these years. We're seeing new patients. We're seeing new people who are coming into the system and accessing care instead of using other types of ancillary cares like jails and police departments and hospital emergency departments and freestanding emergency rooms. We're starting to see a lot of people who come in who've never been in our care. And I thought that was a unique thing that we really weren't anticipating. And so certainly working up new patients for the first time, is a lot more intense than taking somebody who may have been in your system for 20 or 30 years and being able to pull up their EMR and figure out what's going on for a tune-up. So that's a little bit of a different twist. But overall, I think we're doing very well. I have to do a shout out to our leadership, Dr. Parker, Megan Briggs, Dr. Ingerreiser, Dr. Gibson. Those people, Laurel, have done an incredible job of getting our crisis center up and rolling. We have gone through one renovation with an existing facility that we already had, but we're also have 2 more renovations to add to it. So that's a little bit of an update on where we are, and I'll turn it back over to you.
Thank you both. So I will say that y'all have worked really hard. Y'all both have really great teams, and I'm excited to see how it's actually hit the ground. I look forward to coming and touring your facilities now and seeing your team again. So I've had quite a few questions, and Commissioner Boswell, this may be for I've had quite a few direct messages, all asking about FEP funding for the crisis system. Do you want to speak to that and how Alabama is using that from your list?
Sure. We are very fortunate that we received a general fund appropriation the first year for the first round of crisis centers of $18 million. And so there was just a groundswell of interest among our legislative folks about how to address crisis services in local communities. And so we've been very fortunate with that. They appropriated an additional $6 million in 2021 for that. 2022 for the 4th crisis center. And so for the most part, our crisis centers right now are funded through a state appropriation. We give $1 million to each one out of our special mental health fund. So we have a fund in our state that is dedicated to mental health, the revenue stream actually that comes directly to us. We do plan to use the CCBHC model as our pivot to where we want to be in 5 years. And so we anticipate as we move forward, developing a payment methodology that obviously includes Medicaid and some other payers. But right now, for the most part, our crisis system in Alabama is being paid for through state dollars.
Great. I think that is what people needed to hear. I really appreciate you taking a moment. Thank you for the Alabama team. Great presentation, great feedback. And as always, we will all look forward to seeing how y'all move forward. So I think now we're going to go ahead, Kim.
Alabama anytime. So you just let me know.
Thank you. I drive through a lot going back and forth home. So I'm originally from Mississippi. So, you know, that road from Georgia to Jackson, I pass right through. Okay, I think we're going to switch and move to national updates. So for SAMHSA, Richard McKeon has joined us. So Richard, I'm going to turn it over to you. Thank you for joining.
Thank you so much. Very pleased to be able to give give the update. There obviously continues to be a tremendous amount of federal engagement around 988, including the Domestic Policy Council at the White House, Department of Health and Human Services, VA, FCC, et cetera. I'll just mention several different things. There was a notice in the Federal Register about additional funding going to Vibrant to support the backup centers, which are the last line of defense for 988 in terms of capacity, as well as the core chat and text services, which are also critical. There is additional funding through ARP dollars that will be coming as well. Focused on state support for local crisis centers. More information about that should be out, very soon. Additionally, I think most of you know the FCC has ordered texting to 988 to be facilitated by the same July 16th, 2022 deadline. We've already begun to have contact with not only with the FCC, of course, but also with different carriers. Communicating with Vibrant to allow the technology connections that will need to be made to facilitate that. There are also discussions to make sure that veterans can have access to the Veterans Crisis Line texting service. That's an important priority for us to develop the protocol for as well. People have heard me talk before about the importance of the coordination between 988 and 911. We had another call earlier today with the Office of Emergency Medical Services and the Department of Transportation, who are helping to advise us on some of the key partners and key tasks that we need to accomplish. I was very pleased last week to be able to visit two really model programs, one in Houston, one in Los Angeles. And the one in Houston, the Harris Center co-locates at the Houston 911 PSAP. It's quite an impressive operation. And then went to Los Angeles, where D.D. Hirsch, the local center there, has a partnership with the LA PSAP operating out of the Los Angeles Police Department. And they have data that their program has led to diversion of between 1,300 and 1,400 calls that would have otherwise gotten police response that instead D.D. Hirsch was able to answer without the use of the police. Interestingly, their data suggests that those were disproportionately males of color. So that was very intriguing data. Some of the officials there have termed it equity in action. So we're continuing to look at this, not only in terms of model programs, but also in terms of the challenges in areas that may not have the access to resources that Houston and Los Angeles do. So a key priority for us to make sure that these links are as effective as is possible. So I will stop there. Debbie, you're on mute.
Thank you, Richard. I think
Oh,
you
and
were
you,
the
have,
only-
you put up the picture of our team. Great,
Yes.
thank you.
So this is the updated 9818 for SAMHSA. Do you want to say anything about it, Richard? Because I think you're the only one on today for SAMHSA.
Yes, and that was in part because we were actually doing a briefing for the White House Domestic Policy Council on 988. And so most of us were on there, but I jumped off to make sure I could be with you, for this. So this is our team, and we're continuing to build the team out because this is more than a one-person job being ready for this. So these are all the folks who are working at SAMHSA on this.
Great. Thank you so much, Richard. We appreciate you breaking away. These are the pillars. Do you need to go over those, or do you want people just to have them?
Well, these are the kind of four buckets we're calling the four pillars because they're really the strength of the foundation, moving forward. So we, at another time, if you want, we can do a deeper dive into these, but as you can see, they, federal planning and convening is an important part of this. Operational readiness, and these have different leads: operational readiness of the Lifeline Network, messaging and public communication, and then the foundation for comprehensive crisis services.
Great. All right. I think we are ready to turn it over to Brian Hepburn with Nashville to look at update from Nashville. Brian?
Thank you, Debbie. It's good to see you and hear you. And thank you to Richard for the SAMHSA presentation. And also, I want to say how proud we are of Alabama and the work that they're doing in crisis services. One of the things one of the areas that all states are working on is attention to child and adolescent crisis services. So I wanted to highlight that the Surgeon General came out this week. The Surgeon General Vivek Murthy issued a new Surgeon General's report advisory, and it highlighted the urgent need to address the nation's youth mental health crisis. They said, as the nation continues to work to protect the health and safety of America's youth during this pandemic with the pediatric vaccine push amid concerns of the emerging Omicron variant, the U.S. Surgeon General's advisory on protecting youth mental health outlines the pandemic's unprecedented impacts on the mental health of America's youth and families, as well as the mental health challenges that existed long before the pandemic. One of the recommendations that they made was to expand and strengthen suicide prevention and mental health crisis services. An example opportunities include providing flexible funding to fund crisis care needs, increasing access to intensive outpatient and other step-down programs, supporting access to trauma-informed services for traumatized children, implementing the 988 mental health crisis and suicide prevention hotline, and promoting public awareness of crisis hotlines and other resources. We want to highlight this for a couple of reasons. One is because it really is consistent with what's happening across all the states in terms of attention to the needs of children and adolescents. The other is to say a little bit about Dr. Murthy. He came to talk to us at one of our annual meetings, And he was outstanding. He talked about mental illness in his own family, and he was so open with our leadership. It was one of the highlights of the conference. So I wanted to just attend to that. So next slide, please. Oh, and in terms of the Surgeon General's report, I think Megan was going to put a link in, so hopefully that happened. I wanted to go through these papers a little bit just to identify that these are all papers that are put together by SAMHSA and Nashville, 10 papers a year. And over the last 2 years, we've really focused on crisis services and 988 and crisis services. And so if you click on 2020, 2021, it'll take you to where those papers are. And if Megan is able to overcome technical difficulties, she will be putting links on in the chat for this. The two papers that I wanted to identify, one is the 2020 paper, Improving the Child and Adolescent Crisis System, Shifting from a 911 to a 988 paradigm. This was done by Sharon Hoover. It's an excellent paper, and I recommend it to you. 2021 paper was on the effects of COVID to children and children, youth, and family. It was by Dr. Ken Rogers, the commissioner in South Carolina, and it's also an excellent paper. So with that, thank you. It's really important that we take care of our kids, and we really appreciate the attention that everyone is giving them. Thank you.
Thank you, Brian. And Megan did get both of the links in the chat, so make sure y'all click on them and read the papers. They're excellent work and excellent guides. And thank you, Nashville, for your continued leadership for states. We really appreciate it. Okay, I feel like there needs to be music as we move into the hot seat. So we are getting ready for the crisis trivia hot seat. Move to the next slide. Okay, so we're keeping it all in the family. Wendy Ty-Green, are you available?
Yes, hi.
Okay, so Wendy is my partner on our 988 implementation, so I can't help her. This is the hot seat question. Well, this is last week's in the special edition of Nashville's September 15th Crisis Jam. Terrace David Overfall and Maricopa County, Arizona providers reported 18% of mobile crisis referrals originate with police. For the 82% that originate with the community, now they're moving to the next one. So this is the hot seat question for you, Wendy, I think.
Oops.
Have we got it? Y'all are having to block it out a little bit. All right, in 2006, this state convened 2 safety summits and produced a report for the safety of outpatient community mental health workers. I was one of those back then, so I know the answer. What was the state, and name one of the recommendations? So you have the ability to phone a friend or ask the audience.
Well, let me do the ask the audience function here because I do not know the answer to it, even though I was in state service at the time. And let me just share, 2006 was the year Georgia implemented the Georgia Crisis and Access Line. And I was the procurement manager and designer for that process. So 2006, this is a great year for community-based service, especially in Georgia.
So you've got
Okay.
one person saying Washington. Nope, New Jersey's another one. Come on, team, help her out. Where was the
Okay.
report?
2 for Washington. So, so let me just say, Anna, who chimed in here, is also the member of the 3-person leadership team on 988 in Georgia. So she is my colleague, and so I would put my life in her hands. And so I am going to put some trust there and say Washington State.
Okay, that's part 1. Can you name one of the recommendations for in-home safety for the outpatient mental health workers that are doing work?
So again, I will let the audience start chiming in, but I'm going to vamp a little bit. I am going to say that
Nevada's helping out.
I'm going to say, because at the time they weren't as prevalent, that the use of mobile phones, having connectivity through mobile devices, maybe was one of the recommendations. I can take a 50% on this.
Okay, we're gonna do a 50%. Let's unhide the answer. So Washington is correct. And so 2-person outreaches, just like we built into mobile crisis for Georgia, should be the standard of practice. Yes, always
Gotcha.
go out in 2s. Provide 24 access to key clinical and justice involvement data history so that we know that people are safe. And then collaborate with law enforcement on statewide standardized protocols. And coordinate your response when needed. That was the first thing I always train my staff. You're going into a volatile situation, make sure we know and police know. So thank you, Wendy, for being such a great sport. We appreciate it. And thanks to all those who helped her out.
Yes, thank you.
So on the national front, Sarah Corcoran is not going to be here today. So we're going to move past her. Update has not been updated since last week. It will still be in the slides and all of the bills to follow, but hopefully she'll be back next week to give us a final update before we take a couple of weeks off. And then there is no AFSP update this week. So we're going to go straight to state updates. And we have Laura Evans from Vibrant here, who is going to share an update with us. Laura?
Hi, thank you. And I just want to start off by thanking Brian and Nashville and Samson, of course, Richard, for all of the great papers, all of the leadership. We really are in a better position because of that. I also do want to acknowledge Georgia and Alabama in the work that you all are leading on crisis services. I'm very glad to hear, very appreciative to hear that the Vibrant 988 state planning grants have been helpful to you all. So again, just wanted to acknowledge the work that you guys are doing and be really grateful to be a small part of that. I just wanted to, just a couple of things to know. One, it's actually from the FCC that we've seen in the Federal Register, that the FCC will be reaching out to states. The FCC, as part of the Designation Act, is required to have annual reports on the 988 surcharge that any state may implement. This is very similar to the 911 reports that FCC provides to Congress every year. So if your state agency receives a notice from FCC around a 988 fee, even if your state didn't enact one, nothing to be alarmed around. This is just part of their annual surveying to kind of see the status. So just first wanted to share that. And of course, FCC is probably the best contact, but we did see that in the Federal Register and wanted to share that notice with everyone. In a similar vein of workforce, I think we're seeing a lot of workforce legislation being introduced, pre-filed, and on the regulatory front. So I'll share an update that we have seen from Massachusetts, and I'm not sure if there's anyone from Massachusetts here who could speak more to it, but their House Bill 4269, which is an omnibus, so there's lots of various provisions, does contain a provision around a behavioral health trust fund. Essentially, that would be kind of managed through the Department of Public Health, and that is to help build out that workforce. And there's some other pieces around ensuring equitable access to culturally competent behavioral health care. Some other provisions in that omnibus also include funding around behavioral health care that may have been exacerbated through COVID-19. So it's a big bill, still digging through it, but if anyone is on and wants to speak to it or put in the chat, happy to share and kind of have folks shed more light. We're also seeing legislation being pre-filed in Washington in anticipation of the 22 session. And so just going to keep an eye out there. There's some items related to just the crisis continuum. And so I don't want to get too far out ahead. So just want to make sure that folks are paying attention and kind of being a part of those conversations. We're seeing too, both in Utah, we heard at the Mental Health America Policy Council conference, Utah's doing some work on licensing. We just saw a notice in the Federal Register around licensing for individuals who could respond to people who are in a crisis and need someone to come out. So again, those are some activities going on, not necessarily legislatively through the legislature, but in California, that's a reg. Utah, they're still working through some items. So just encouraging everyone to kind of really engage. If your state has a 988 plan grant, make sure folks are part of that. So we'll have to update the map. I know this is NAMI's map, so I'll leave it to Steph and Hannah to talk about it, but we'll have to, as we start thinking about pre-files, come up with a way that we can visually showcase what's going on in the states, because there's a lot of activity.
It's moving fast, and we get closer to the holidays. It feels like it moves faster and faster. Thank you. I think that NAMI is actually on. Stephanie, are you on?
Yes, I am. And I can add a little bit to Laura's update. We had our monthly 988 state advocates call on Monday. And just to clarify also, I saw a question in the chat on the map. Just the states in white are just reflect states that have not introduced legislation as of yet that deal really directly with 988 implementation. So we heard on Monday's call, and that's a monthly call for anyone that wants to join that's really involved with 988 state level advocacy. And I can put a link on how to join that call in the chat here. That not a lot of legislation is moving at the moment, but a lot of states are working on budget requests with the 988 launch date right around the corner, including in California. Advocates there are looking at a $30 million request for the Office of Emergency Services, focused on 911 and 988 interoperability. In Maryland, our friends at the Behavioral Health Systems Baltimore have launched the Fund MD 988 campaign, and they'll be asking for $10 million to support call centers in FY 2022. Similarly, we're hearing that they'll be pursuing a budget request in Florida as well. And I'm also, as Laura mentioned, we'll have to figure out a way to kind of also reflect when we are hearing that legislation is on its way or imminent, because state legislative sessions will be kicking off in most states in early January. And we are expecting legislation soon in Rhode Island, Pennsylvania, Hawaii, and Oklahoma as well. And if anyone, any of our partners also from AFSP or anyone else online has any further updates, feel free to chime in.
I was told AFSP did not have updates today. But if so, if anybody's on and needs to give an update, we have a couple of minutes. Thank you for the links in the chat. So if you would like to join the NAMI calls, I hear they are very informative. We had a lot from our team on them, and they were texting me, "Did you know?" And I was like, "Yes, we knew about this." So it was great to know how helpful it was to a lot of our team. So thank you for all the work you do. I think that we have state slides next, and just a reminder, there's a couple of slides that have been completed. So we've got Washington up now, we've had Nevada, and the team is working to build out more for other states, and you will start seeing those added as they get more information. So very helpful to have kind of just that one pager and to kind of do the lay of the land on what's out there as we prepare for 988. So if someone reaches out to get a little bit more information from you, please make sure you respond. What are the fees referenced on the map is one of the questions that came forth. Stephanie, do you want to mention that?
Yes, I can clarify. Yes, the fees refer to monthly phone bills that states can choose to add to monthly individual customers' monthly phone bills, but they have to do that through legislation. So far, 4 states have decided to do that, but the option still remains for all of the other states.
And Dr. Tyler, this is just like 911. In most states, they're allowed to charge a fee on cell phone bills, and this would be the same that's allotted in the national law. Okay, so if you'll pull up kind of what's coming up in the next few weeks, a couple of reminders for people. There's the Nevada slide. All right, so we have some great presentations coming up. There is going to be a focus on child and adolescence and family in crisis next week. Melinda Baldwin is going to be the guest speaker. And then as a reminder, we've got 2 weeks off. So the week of Christmas and the week of New Year, please spend time with your families, take care of yourself, and we will be back. It does not have a date here for January, the first week of January, but that doesn't mean there's not a meeting. It means that we haven't nailed down the topic and the guest speaker yet. So if you have topics that you would like to hear about, if you could email Karen, who sends out the invitation, and David Covington, who is the CEO of RI and kind of helps with this platform, give them topics that you haven't heard about yet. They will vet those and they will work to schedule guest speakers. It's not as scary as it sounds. So if you get asked, you know, they prepare you well. And then later in the month of January, we have the 911 and 988 integration, which is very exciting. And then the Medicaid parity and crisis. Patrick Kennedy is coming. And if you haven't heard him speak on parity, you don't want to miss that. He is an excellent speaker. So we will be back January 5th. Just know that will be hopefully on the calendar for next week. It'll have that filled in. But if not, we're only taking off the weeks of the 22nd and the 29th. And Karen put her email in the chat in case anybody has it. And I think we're actually going to end on time today since we were a couple of presenters shy today. So thank you all for the work you're doing in your states and on the national level. And we look forward to seeing you back here next week.